Hello everyone, welcome back to pre-rehab videos that we are recording with Cancer Bridges to help make your journey a little bit easier with every possible educational tip that we could give you. You could use all of them or some of them depending upon your capacity and limitations. This is a medical disclaimer that I'm trying to present as much as possible evidence-based techniques and practices during your onco rehabilitation. This is the first part again of pre-rehab. We have recorded few videos prior to this one. Today's video is focusing very specifically on functional training. What is functional training? Functional training is practice and training of the functions that could become harder temporarily after your surgery, during your chemotherapy, during and after your radiation, in whichever order your treatments occur. Why is functional training so important? Instead of trying to figure out and somehow get through difficult times during and after your treatment, we rather anticipate what could be difficult for myself depending upon my abilities and my limitations. Am I going to have a difficult time sleeping on my back when I have an abdominal surgery? Am I going to have a difficult time getting in and out of the car because it is lower extremity surgery? Am I going to have a difficult time getting in and out of the bed if I'm going to have, for example, a mastectomy surgery? Am I going to have a difficult time laying straight or on my side because I'm going to have head and neck surgery? Anticipating what limitations you might incur in the coming days will help you better prepare for those limitations. It also gives your caregiver a chance to understand where they might be able to support you, where they might be able to make your journey, your functions easier. Will it be difficulty reaching overhead? Will it be difficulty putting your clothes on and off? Will it be difficulty while transitioning, etc.? So it is not just for the patient, but it is a good insight for the caregiver and help prepare both the patients and hopefully the caregivers for upcoming limitations and deconditioning. Why is functional training important for pre-rehab? I've already mentioned, but this is just listed better. There could be limitations in bed mobility. There could be limitations in transfer because of the suture, because of the swelling, because of the weakness. For example, chemotherapy patients might have difficulty in balance because of peripheral neuropathy. Radiation patients might have difficulty putting weight on their arms because of ongoing radiation treatments, which could cause radiation-induced burns, cause swelling, inflammation, and the patient is not able to put support or give weight on their arm while going through those treatments. So there are potential limitations that we expect, and we are basically preparing for them with functional training. Limitations, as I mentioned, could come in bed mobility, they could come during transfers, they could come in stair climbing if you live in a multi-level house, they could come while going in and out of your car, or any other ADLs, which is activities of daily living, for example, grooming, showering, using your restroom, dressing, etc. I have given few examples in how to anticipate and how to prepare yourself and your caregivers for these potential limitations. But the list is long, depending upon where you're having the surgery, what treatments you're going to. Sit with yourself, sit with your caregivers, and plan for these yourself. These are just few examples that I thought might help you just understand what I'm talking about when we talk about functional training. So the first most important is sleep. We all have compromised sleep because of fatigue, because of pain, because of medications, because of limitations in your motions, body positioning, etc. These are so many different ways in which you can already anticipate where you would need the support and how you are going to support yourself. Are you going to roll that down comforter? Are you going to buy some new mastectomy pillows? Are you going to use tons and tons of soft pillows that you already have? Are you going to use a combination of a blanket and combination of pillows? What is it that is going to hopefully make your sleep positioning and therefore your sleep better? This is me a month out after my mastectomy surgery, where I have supported my lower extremity, my bilateral shoulder, and I couldn't lay on my back, so I was almost sleeping in a semi-reclined position. I'm just going to play this video again to show you in how many different ways I had supported myself to make my sleep positioning a little better. You could be using folded down comforter. This patient has extremely well supported herself by using several pillows, something that a head and neck cancer patient could do. This patient has supported herself in the lower extremity by preventing the tug or the pull on the abdominal region, something that a hysterectomy patient, a colorectal surgery patient could do. So just several ways in which we could modify our sleeping position. Transfers are usually very painful and very difficult after the surgery because we want to avoid the strain, the tug, the push, and the pull on the surgical part. We are pretty fatigued, we are sleep deprived, we are in pain, and transfers, which kind of go from anti-gravity position to other anti-gravity position, could be very difficult on the entire system of the body. So I have just shown a couple of examples of transfers, but this is something really helpful to practice by yourself and with your caregivers prior to the anticipated treatments or procedures, just so that you have a fair idea of how it's going to feel like or where you might need the help when you're actually doing it. Imagine if you have surgery in your chest or your shoulder or anywhere in your upper region, then in the initial few days, you might need a caregiver support. So this is how you want to instruct your caregiver to help you get out of the bed. You first want to, hopefully your lower extremities are functioning. They can help you do easier transition for the lower half of the body. So you're going to switch side, and now my caregiver is going to support my entire back. Make sure that you tell the caregiver to support your entire back. And this is how you want to. Initial few days after surgery, in and out of the bed can be very difficult transitions, just because the wound or the sutures can be very painful with movements, especially sit to stand. You want to try to splint the part that has undergone the surgical procedure using a soft pillow. The splinting of the part gives additional support to the suture. So for example, if I have an abdominal surgery, I'm going to splint my abdomen and I'm going to use pressure on my lower extremity and my upper extremity to do the transition. It will be looking something like this. So if I have any kind of abdominal incision, I'm going to splint it. I'm going to make my legs as one unit, almost like a tail of mermaid, do very small shifts. Because my procedure is in the abdomen, my upper extremity hopefully are strong to give some pressure, and I'm going to come up in a very slow movement. I am not going to do a sudden jerk. So splinting of the part is very important when we are trying to do transitions from sit to stand. There are several ways in which you can support your positioning or your transfers while using the restroom. You could try to train your caregiver If you anticipate a lot of limitations, you could try to install a couple of armrests, use a shower chair, use your walker, practice in your actual restroom so that you can anticipate limitations and support yourself and prepare better for them. This is a very, very important functional training part because we are going to do it several times a day and we're going to need the support for several weeks after the surgery or treatments. For another example, for lower abdominal surgeries such as hysterectomy or any kind of colorectal surgeries, when the abdomen has tenderness, swelling, healing wounds and sutures, we want to avoid any kind of strain on this region. So there are several ways by which we can attempt to do bowel and bladder emptying without putting strain on these recovering structures. So it is important to not strain, especially in the early few weeks of your surgery. It is important to try to support your bilateral lower extremity on a small step stool or a squatty potty, yoga blocks, racks of books, just so that you can decrease the pressure in your trunk, in your lower abdomen. And these are few more tips. You want to avoid strain, push or pull on the surgical part. You want to support your lower extremity to prevent any kind of additional strain. You want to splint the part using a pillow if required. And instead of holding your breath and pushing to poop or holding your breath and pushing to pee, you rather do birthday candle breathing as demonstrated here, so that you relieve the pressure from your abdomen, you decrease the strain on your internal organs and decrease the strain on your sutures while voiding your bowel and bladder. There are lots of YouTube videos available on how to poop after C-section, how to poop after hysterectomy or any kind of abdominal surgery. I highly encourage you to explore this part more if this is a functional training part that is relevant to yourself. Again, functional fitness emphasizes exercise and movements that engage multiple muscle groups and mimic natural everyday actions. Functional fitness is about preparing your body for demands of daily life. I hope this can give you some insight of what kind of functional training is relevant to yourself, whether it is your car transfers, getting in and out of the house, stair climbing, going upstairs, moving your stuff downstairs if upstairs is going to be difficult in the first few weeks. Several things to think about, but the more you are able to prepare yourself and your caregiver, the easier your recovery, less painful your journey will become. I'm hoping that you are enjoying these educational videos as a part of Pre-Rehab series with Cancer Bridges, and please follow along for a few more videos that I'm going to bring forward in the next few weeks. Thank you so much.